So when patients come in, I usually talk about birth control pills, and in that same family of birth control pills, there's the birth control patch, and then a device called the NuvaRing. So birth control pills, the patch and the ring, all act by giving synthetic hormones into our system that kind of trick our body into thinking that it's already pregnant, and they suppress our body from maturing an egg and from ovulating. With the birth control pill, you need to take it every single day at about the same time, or within 1 month it'll be effective at preventing pregnancy. Side effects that are potential with these forms can be things like breast tenderness, nausea, sometimes bloating. Sometimes you can have a little bit of irregular bleeding with the first month or so as your body kind of adjusts to the hormones, but those side effects all typically get better within a month or two. So I try to encourage patients, if we're starting a pill or the patch or a NuvaRing, try to give your body 2-3 months to adjust to it. So they can be very beneficial for treating acne and PMS, but some people are sensitive to them and may get moodier. Changes in the type of hormones or the type of pill can sometimes correct that, but sometimes all the pills will have similar effects. And I think that's a nice starter method. The patch is very similar to the pill, except that instead of once a day, you do it once a week. And so every week, alternating weeks, you put the patch on a hip. A week later, you take it off and put the patch on the other hip, and then go back to the other side. And if you want to continue having a monthly menstrual cycle, like most women are used to, then the 4th week you leave the patch off, or the 4th week of the pill pack, you take the sugar pills, the placebo pills, and you get your cycle. If you prefer not to have a period every month, which is a safe, wonderful option that most women appreciate, then you can just continue applying the patches for 3 months, then take a break, or 6 months, then take a break, and then have a period kind of at your convenience and discretion. The NuvaRing requires a little bit more thought and planning. The commercials promote it as once a month birth control, but after your period ends, you squish this soft, flexible ring that has the hormones impregnated into it and insert it into the vagina, and it stays in. You leave it in for 3 weeks, and then at the end of the 3rd week, they have to reach inside the vagina and fish it out and throw it away. Then you get your period that week, and then when the period's done a week later, you put the new ring inside. Again, you could skip the period if you wanted to and just insert ring after ring, and that just allows you a little bit of convenience if you're going on vacation or planning a trip or a honeymoon and you don't want to get your period while you're gone. And then we transition into a category called LARCs, that stands for long-acting reversible contraceptives. The birth control pill and the patch and the ring all get about 96% effective with perfect use. The LARC